help diabetic patients, an experiment on diabetic patients with his or her consent is actually justifiable, right? It's actually justified. Right? I don't want to get into the process of justification because it's far more complex than I need to discuss here, but just a general sense, it makes sense, right? If I'm sick, and as I just said in my earlier example, if I'm sick and my diabetes is affecting it's affecting the sensation in my feet. I can't really feel my toes because my diabetes is numbing my feet. And I go to and of course I'm thereby susceptible to infection and disease and amputation and such. So I go to my medical practitioner and I say, hey, my diabetes is really bothering me. I already know I have it. My feet are numb. And the medical practitioner hears or has done research that could profoundly benefit the numbness in my feet and runs a series of tests and decides to suggest treatment that directly affects what it was that brought me to the medical establishment for help in the first place. I mean, obviously, rather obviously, that is justifiable, right? The medical practitioner is justified in offering alternatives, treatments, therapies to the patient who has directly come to the medical establishment for some sort of treatment, or at least understanding that affects their health, right? It's therapeutic. I mean, it's really not. I put justified in italics because I wanted to go more into a conceptual discussion of justification, but I realize now it wouldn't be appropriate because it would take us off of sort of the analysis into medical ethics. So just know that justification in this sense is sort of duh, and that's the extent of the discussion. It's obviously justified to offer treatments for diabetes with someone afflicted with diabetes. We'll leave it at that. Okay, B. So we have therapeutic experiments and therapeutic experimentation as the first form of beneficence. The next is non-therapeutic, right? Alright, so non-therapeutic experiments. Same thing, human subject experimentation. That does not benefit, right? That does not benefit the patient's well-being, health, and such. It doesn't, it's very important right here, before I go on, that a lot of the stuff that I've read on the internet was a little off in their understanding. It was a little biased. It doesn't explicitly mean then, when we're talking about non-therapeutic experimentation or non-therapeutic experiments, that the purpose of, and I hope I discussed, I'm sure I put this in my notes, but I want to say it now formally. It does not mean, to be clear, it does not mean that if we are talking or analyzing conceptually the role of non-therapeutic experiments, that since non-therapeutics are not in a position to directly benefit the patient, that all non-therapeutic experiments are thereby used to impose harm on the patients. That's false. A lot of the stuff that I saw on the internet, was just completely wrong in this regard. It could be the case that for some non-therapeutic experiments that there is a direct intent by practitioners within the medical community to harm their subjects, which is obviously immoral, unethical, and illegal. No one's denying that. But you cannot make the claim, and it is false to make the claim, that if we're talking about non-therapeutic experiments, that because they don't benefit, they're therefore in place to harm. That's false. There are obviously cases wherein the medical practitioner isn't going to, the experimentation, the treatment, the remedy, what have you, the tests more properly, are not going to benefit the individual patient or patients. It's not going to benefit the patient, but it's also not used to hurt the patient. Right? It could be just at this mode a means of assessing. It's not going to benefit you, it's not going to harm you. You might be compensated for your participation in this medical experiment. You run your tests, you gather your data, you pull some blood, what have you, blah, blah, blah. Doesn't benefit the patient at all. Definitely not going to harm the patient either. Right? So, yes, are some non-therapeutic experiments designed, unfortunately, to harm the subjects? Absolutely. Does that mean that all non-therapeutic experiments are designed to harm or inherently harmful to the subjects? No. The only difference is that they don't benefit. It doesn't have to go to the next extent to actually harm. So on a continuum, we have beneficence, we have sort of this ambiguous neutralized state of, to be technical, non-therapeutic. So beneficence or therapeutic, non-therapeutic, and then maleficence, right? So this is the continuum. Beneficence, benefit, non-therapeutic, neither benefit nor harm, and then maleficence, which is to harm. Okay. So human subject experimentation that does not benefit the patient's well-being, health, blah, blah, blah. This form of medical experimentation can either be moral, ethical, or immoral, unethical, given patient full consent, disclosure, and physician intent. And I'll talk more about that now, right? If the intent of the, and I think I do talk about this. Let me just check, because if I don't, I'll bring it up right now. No, I don't think I do. But, perfect example, I don't talk about it now, but where did I talk about? I think it was in my ethics. I did another ethics. It's not ethics in medical ethics. I did an ethics in qualitative methods research. That's where it was. So I did a lecture series. I've done already a lecture series on ethics and conduct in qualitative methods research, and I begin like right from the back talking about the Tuskegee syphilis experiments that were used. Perfect example of non-therapeutic experimentation that was detrimental and, you know, specifically designed to harm the patient. The idea of maleficence is more a conceptual idea. Usually the literature divides it into either therapeutic or non-therapeutic. Me, I've introduced the idea of maleficence because it just makes natural progression. It makes sense to call it that. But within the canon proper, you would identify, at least on this grounds, I would augment the canon by incorporating maleficence, which I'm not going to write on the board. I'm just discussing because it's not necessarily canonical. You would identify the Tuskegee syphilis experimentation on black men as being non-therapeutic. It didn't benefit them, but it harmed them. And again, remember the caveat that I gave earlier, that it doesn't have to, it's not therefore the case that non-therapeutic experiments as such are designed to harm. That would be false. Okay, so let me give you an example of a moral, ethical use of non-therapeutic. So now we're going to get even more specific, right? The idea is to offer you an example of non-therapeutic experimentation on human subjects that is moral. Okay. The aim, this is a direct quote. Let me cap my marker. The aim of a non-therapeutic trial is to obtain knowledge which may contribute toward future development of new forms of treatment or procedures. And that's fair, right? As I said before, right? I said a couple minutes ago, someone comes in, it's not going to benefit you. You might be compensated monetarily or with free prescriptions, what have you. If you participate in this, this assessment, you come of your own volition. No one's coerced you. You recognize that you're not going to be. It's not going to directly benefit you, but for whatever reason, you are a representative of a segment of the population that the medical community is interested in for whatever reasons, and they run some tests. They gather some blood. They do what have you. In order to, quote, where are we? In order to, quote, future develop new forms of treatment and procedures. It's not going to benefit you now, but it might benefit others in the future. It's a non-therapeutic experiment, and there's no problem with that. And I have a hyperlink to the reference. Where the patient is fully informed of the risk and has consented to participation, then we're talking about a moral and ethical use of non-therapeutic experimentation. So important to be fair and objective to the analysis when we talk about beneficence, subdivided into therapeutic experimentation, non-therapeutic experimentation. Non-therapeutic experimentation, moral, immoral. The moral aspects of non-therapeutic experimentation is the assessment, the analysis, the procuring of data in order to benefit someone else at some time t in the future, right? With respect to the patient population participating in the experiment, there's no direct benefit to the patient, but the patient knows this. The patient is consented to participate. and there isn't any intent to harm. So, not a problem.